We're going to go ahead and begin. From 11 to 11:30, we do networking and get our lunch, so hopefully you had fun talking to people. And I hope everyone is having an amazing day. I'd like to welcome you and thank you for attending our June quarterly membership luncheon, Growing for the Future, a Hunt Regional Overview. At this time, I have some ambassadors who are going to be recognizing new members. So if you could come and stand at the stairs right here, and I will call you up. We're going to start doing this at all our quarterly membership luncheons. Our ambassadors are going to recognize new members that have joined the chamber. And the new members are coming, yes.
Good. Is it morning or is it afternoon? It's afternoon. Good afternoon, everybody. Come on. All right. New chamber member Laura Ashley Hartline with Remax Realtors. Is there anything that you want to say and kind of give these people your 2 cents on how great you are and what you can do? Oh, I do this? Well, she's got to tell me, and then so why can't you do this right now? Oh, okay. Well, no, I don't remember. My name is Larry Cavanis. I'm the marketing director for ServPro of Northeast Collin County, Greenville. And ServPro, we do fire, water, smoke restoration. And we just pray that nothing ever happens to any business or any residents that has those issues, but we can't control those things. So when that does happen, you know who to call. Call Larry with ServPro Northeast Collin County. Anyway, and Laura Ashley Hartline with Remax. What do you want to say? She's a realtor with Remax. All right. Thank you all. Appreciate it.
Hey y'all, I'm Jason Carpenter with Latson's Office Solutions, now latsons.com. Do printing, promo, furniture, and office products. So we're not talking about me today though. We're talking about Mr. Mark Easton here. He's Revolution Mortgage. He's also in the Greenville Young Professionals. If you're not a part of that group, join it. If you're young enough, sorry folks. But he is a new loan officer here, and he does residential loans, any type of residential loan. This guy, Mark Easton of Revolution Mortgage. Thank you. Welcome, Mark.
I am Kami Williams with GEUS. We're your nationally recognized public power utility serving Greenville for over 130 years with electricity, cable, and internet. And today it's my pleasure to introduce you to 1903 Nutrition. If you can remember their name, you'll know where they're at. They're on 1903. And you guys are familiar with those shakes, drinks, coffees, hot and iced, so don't shy away from that this summer, and nutrition plans. And this is J.P. Fitzgerald. She's the owner and operator of that location. You guys welcome her to the chamber and go visit her.
And there's a grand opening Saturday at noon.
With live music.
Good afternoon, everyone. I'm David Weiland. I'm a broker associate with Century 21 Patterson Agency, and you know what we do, so I'll stop there. I've got a new best friend already, Ms. Alicia Swanson. Alicia is a Hunt County, Quinlan native. She is a business owner of Swanson Hair and Academy. I was promised myself I would remember and not have to read it, but I broke my promise, didn't I? but this is a hard-working, goal-driven young lady. She takes people who have high school graduates who graduated from cosmetology courses or any school, really teaches them the business. You know, in many other businesses, such as real estate, you take courses. Courses are designed to get you to pass the exam, but you really don't know how to do the work after you become licensed. This is where Alicia comes in. She teaches them not only the finer arts of hair cutting and hair coloring, but teaches them how to run a business, how to make money. It's a 2-year internship program located on Stonewall Street, 2 doors down from Ricky Sanders' barbershop. I think everyone knows where that is. So come see Alicia, and I was going to go see her, let her cut my hair, but she's told me that she doesn't cut men's hair. She refers them to Ricky. So you ladies come see, and she also has got associates that does eyelashes and nail manicure, and I'm sure pedicures. No pedicures? Oh, no sticky meat in there, huh? Okay.
It's fun to be here today. I just wanted to say how excited I am to see some of these new, younger people joining. So Laura Ashley Hartline has been, well, she grew up with my daughter since they were 1 year old. And Mark, I met him down at Quillen and find out that he is a mortgage lender. And so he just joined. We're happy for that. And then Alicia grew up at my house riding horses, so this is fun. I'm Roxanne Turner. I'm with Turtle Creek Financial Group. I just recently rented a new office downtown across from Max in the D. Hilton building, 2410 Lee Street. Also, if everybody saw the hole in the street, that's where my parking lot is. So anyways, these are my new friends. We've got Trey Mcfarlane and Clay Mills. They are with Datamax. They are out of Sulphur Springs. Sorry, I got to get my glasses on. They are out of Sulphur Springs. They do office solutions. So I'm going to let y'all say a little bit.
Thank you, ma'am. Hi, I'm Clay Mills. I'm the VP of Sales for Datamax. We're a premier Canon copier and printing dealer. I want to introduce Trey Mcfarlane. He's a quality young man, just promoted to area sales manager for this area, based out of Sulphur Springs. Wanted to also thank everyone for the phenomenal growth we've had here in the year and a half we've been in the community. The office size has tripled, which during COVID has been shocking. Trey exemplifies the Datamax way and what we call the Datamax difference. So I invite you to introduce yourself as he introduces himself to you. And for you 20-somethings, no, I was not present at the founding of our company in 1955.
As he said, my name is Trey Mcfarlane. I am the new area sales manager for our Sulphur Springs office. Some of y'all may be familiar with Advantage Copy Systems. Back in 2018, Datamax acquired Advantage Copy Systems in Sulphur Springs, so that's where we are, if anybody knows where that facility is. So we merged with them. A couple of my guys still came in from Advantage Copy. So we have the familiarity with the area, at least with my guys. Like Clay said, I'd love to be able to meet each and every single one of you. So come on and say hi whenever you have a chance.
Hello, my name is Trina Coldine. I'm with Scripps, Senior Center Resources and Public Transit. We are your only senior center in Hunt County, and we are your only public transit. If you need any of those things, let me know, or if you'd like to volunteer. But I've got some new young ladies, speaking of the new generation coming into the chamber. These are my new friends from the Legacy Group, All City Real Estate, Taylor Clark, Sarah Norris, and Stacey Fairweather, and they're missing one today, correct? Jennifer Samples, so she couldn't be with us today. They started their agency in December of 2021. They have a combined experience of 17 years. You can check any of them out on Facebook, and just please make them welcome to our chamber family.
We have two sponsors today that help make our lunch from Chick-fil-A possible. The chamber could not exist without support from businesses like these. Our table sponsor is Libby Daves, the community liaison with Family First Home Health and Hospice. Libby?
Hello. Good afternoon. I wanted to introduce myself. I'm Alyssa Davis. I'm the community liaison for Family First Home Health. Previously, I came from a corporate agency, and anytime I would go to them wanting to get involved in the community, I always had lots of challenges that I would have to overcome. But since I've been at Family First, anytime I want to get involved with anything, especially in Greenville, I get an astounding yes. It's so refreshing to work for a company that is committed to the community. Sorry, getting off script a little bit. Okay, I have a quick question. Raise your hand if any of you have heard of Family First Home Health. Our owners, Jeremy and Kelly Bullock, and Lindsay and Anthony Yost. Okay, wow. So y'all are familiar with us, so I don't need to bore you with all that. But what I want to tell you is about our goals and how that goal is going to be accomplished. Our goal is to make an impact in the lives of our patients and their families in the community. We're driven by purpose, not popularity. Our plan and mission is to provide the highest level of service that produces the greatest outcomes. You may not know this, but all health care agencies are compared and rated by quality of care and patient satisfaction by the Centers of Medicare and Medicaid Services. Based on their outcomes, they're given a star rating. This is important to know when you're choosing care for your loved ones. The future of home care is value-based, and the value is determined by the outcomes and star ratings. You may have agencies that say that the star ratings don't matter, but the fact is outcomes and star ratings do matter, not only to CMS, but they should matter when you're choosing care for yourself or for your loved one. This data is public record on Medicare.gov/care-compare. Going in and out. I got a loud bingo voice. I can't talk without the microphone. As we said, know your data, know the care these agencies provide. Family First has the highest patient satisfaction rating of 5 stars given by CMS, among other 5-star ratings on different sites. Family First is committed to providing quality care to the community. That's why within the last year, we saw a need to be able to provide continuity of care and open up the hospice agency that is accredited and is helping families and patients have a good finish that everyone deserves. We previously saw patients struggling to get to and from important medical appointments and missing necessary medical follow-ups that created the desire to open up Family First non-emergency medical transportation, a company that has doubled in size in the last 3 months while we are still short 2 drivers. So if anybody needs a job, come talk to me. Family First owners are laid back and innovative, but innovative and forward thinkers as they constantly are thinking of ways they can provide services and benefit the community and the outcomes of their patients. If you keep up with the news and who would find who, home health agencies are being swept up by insurance companies. What this tells us is these insurance companies know something, and what that something is the future of healthcare is home care. At Family First, we recognize this and are in the process of developing new and exciting things for the future, so stay tuned. So when values matter, outcomes matter, star ratings matter, and the future of healthcare is home care, we ask you to do your homework, know your data, know your worth, and let our family take care of yours. Thank you.
Thank you, Family First, for your sponsorship. Our advertising sponsor is Deanna Bates, the lead instructor for the competency-based health services administration program with Texas A&M Commerce.
Good morning. So, like she said, I'm Dee Besson. We wanted to come tell you about our brand new Health Services Administration program at A&M Commerce. It is a competency-based program for healthcare workers, healthcare staff, anyone in the healthcare industry. It's designed for working professionals. It is a competency-based program. You can get a bachelor's degree while working. It's all online. Go ahead to the next slide. It's a subscription-based model. So our terms are 7 weeks long, 100% online. For $750 per term, you get however many courses you can complete. So it's a 7-week time frame, like I said, 100% online. All of the open educational resources, all of the books, all of your reading materials are all online. So that $750 is the flat rate. So you can take a few courses. If you can complete those in the first few weeks, you can accelerate to another course. So however many courses you can complete in that 7 weeks is still $750. It's geared toward working adults, so they can do it anytime, at night, after work, on the weekends, anytime they can complete it. It is accredited by all of the necessary accreditation boards. I won't go into all that. But you can see the difference in the cost of these programs. The traditional cost for a degree is about $14,000. Ours, with the ability to accelerate into these courses, runs you about $6,000. So a little less than half the cost. You can transfer in up to 90 credit hours, and one of our wonderful advisors, Ms. Becky, is here with me, she can take all your credit hours and figure out how all that transfers. This is how the courses work. Like we said, they're competency-based, so we take everybody's existing knowledge and let them use it. There's a pre-test at the beginning of every course. If they pass that with an 80%, they go on through that module and don't have to do anything else. They can go to the next module. That's how you get through these classes so quickly. So each class has about 4 modules. You take those pre-tests, make an 80, you're done. There's a final and a course project at the end of each course. So fully flexible, fully online, lets people work, lets them get their degree done, and use their experience to do so, and advance their own career into healthcare leadership. These are some of our students, testimonials. They're all from different backgrounds. This young lady here works as a clinic manager in a tortilla factory, I believe it is. She's a manager. They provide their own health care to their folks there. She wants to be a good role model for her community and is able to work at the same time as getting her degree. Some of the others, it's been important to them to be able to work, be a working mother, work full time, and still complete their degree, where otherwise they would have been able to, or be able to afford it, for that matter. The admissions process, we can get that all to you guys. We have our admissions folks here, and Ms. DeVita and Ms. Becky can explain all that. But you apply, you find out what credit hours go towards your degree, and get you in there and get you going. And if y'all have any questions, we're happy to talk to y'all.
Thank you, Texas A&M. I have a few more individuals and businesses that I'd like to recognize before Hunt Regional begins. We do this every quarterly membership luncheon. So please stand when I call your name or wave. We want you to be recognized. Our chamber board members that are here today. We have Kelly Bullock, Family First Home Health. Lee Bowles, Hunt Regional Healthcare. Kate Ridge, Cornerstone Insurance. I saw her get a phone call, so. Greg Sims, Greenville Board of Development. Holly Gray, Century 21 First Group. Our chamber ambassadors. We have 40 ambassadors, and over half of them are here today. I'm so amazed. Lonnie and Danae and I use them in so many different ways, and we're very grateful for them. Our first one is Deanna Bates, Terry Driggers Realty Service. She's out there. Craig Driggers, L3 Harris. Amy Williams, GEUS. Jason Carpenter, Latsons.com. Trina Coldiron, Senior Center Resources and Public Transit. Libby Daves, Family First Home Health. Leanne Bledsoe, Farmers Insurance. She's out there. Rose Hayden, Hunt Regional Healthcare. Millicent Akufo, OA Property Developers. Dinesha Denny, Remax 3D Real Estate. Karen Clark, Altrusa. Roxanne Turner, Turtle Creek Financial Group. Natalie Pegg, United Way, Hunt County. David Ryland, Century 21 Patterson Agency. Tracy Fenton, Britex Bubbles. Larry Cavanis, Serve Pro. I would like to welcome a new group that we have started at the Greenville Chamber, which is the GYP, which stands for Greenville Young Professionals. They meet twice each month, one for happy hour, of course, can't forget that, and the other is a professional meeting where we invite a leader from the community to come and talk with them about leadership. They have personally met our mayor and our county judge, and in a couple of weeks they're going to be meeting the GISD superintendent. This group is for 19 to 39-year-olds, and if you're interested in joining, and you fit that age range, please see Vinay, our events director, before you leave. I'd like to introduce them that are here today. So if you'll just kind of wave. Mark Easton with Revolution Mortgage. Laura Ashley Hartline with Remax 3D Real Estate. John Nixon with Greenville Board of Development. Chris Mangle with GEUS. Jason Carpenter with Latsons.com. Our business investors that are in the room today: Gold Investors, Alliance Bank, Family First Home Health. Our silver investors: Atmos Energy, Cornerstone Insurance, GEUS, Hunt Regional Healthcare, Texas A&M Commerce. Our bronze investors: At Home Texas Real Estate, Remax 3D Real Estate, Wildcatter Realty Partners, and our biggest investor that we have in the room today is L3 Harris. City Councilwoman Kristen Washington. Greenville Board of Development Greg Sims, John Dixon, Holly Gray. And did Dr. Pam Anglin? She was on the list. She did not make it. So at this time, I'm going to turn it over to Lee Bowles, our President and CEO of Hunt Regional Healthcare.
Thanks, Shelley, and just want to thank all the chamber members and everyone here and our sponsors for just allowing the hospital to come share a few minutes with you today. Let you know all the things we got going on, and it is quite a bit, and I'm just scratching the surface with you. For those of you who don't know me, I am Lee Bowles. My name is Lee. I get called Mr. Bowles all the time now, and I hate it, but if you see me, call me Lee. I am the hospital district CEO since the retirement of Rich Carter back at the end of the year. I've been with the district for 6.5 years before that as the CFO. And I guess one of the reasons everybody calls me Mr. Bowles is because I have been a CFO somewhere since 1992, and I just realized that when I was sitting here thinking about it a while ago. So no wonder I get that a little bit now. Honestly, I never really entertained the thought of wanting to be a hospital CEO. In a role, that role at all, anywhere I've been, until I got here. This is a special place and a special hospital that the community has. A lot of dedicated people work there, and a lot of really skilled people, and you kind of have to be like me and have been around a bit to really have that appreciation. And the great part about it is myself and our board and our physicians and our employees and all our admin team. Everybody just works every day to make it a better place, and that's all I can ask for. Rose, just don't count in 5 minutes of time, but if everybody would just take your phone out for about 30 seconds and bear with me and do a little exercise. This is something I've kind of started doing every day. Just want you to take your phone out, and you might not have no service, because I didn't have any service sitting there just a second ago, and just send a text message of encouragement to somebody. I don't care care of it's your spouse or a child or a coworker or a friend, just share something positive with them. And then just lay your phone back down there and see if you get something back during the 5 minutes I'm going to spend up here, which really that's just so y'all are bored by me and I see you looking at your phone, I won't be thinking about it. Nice little trick there. We got a lot of moving parts going on around our hospital right now, and it's really just to take advantage of the growth in Hunt County. And, you know, we're presented with a huge opportunity. And quite honestly, you know, we're a government public hospital with a lot of restrictions and somewhat limited resources. So it's really difficult for us, not having deep pockets and those kind of things, to take advantage of opportunities. But honestly, we have to, or somebody's going to do it for us. And, you know, we want to be the provider of choice that grows and provides the services for Hunt County and for the employers and the population. First thing I really want to talk about is our expansion project. All of you have kind of seen what's been going on in the back of the hospital. We're spending about $34 million back there to expand and remodel our NICU and Women's Center and our surgery department and add operating rooms and our PT area. It was supposed to have been done in May. We was hoping it would be done in June, but all of you know what's going on with the economy and some of the delays in getting parts and pieces and little things finishing up. You know, we're still optimistic that we'll get this done in a few months. Some issues with some design of some of the power and some of those kind of things that we've had to work through. As you all build a home and those things, you learn through those things, and we have to. But hopefully by late this summer or so, we'll have our expansion open running. And Dr. Atop is our neonatologist, and he is here and will speak with you a few minutes and tell you a little more about that NICU. And I think Colleen Caffey is also with him to talk about the services a little bit more. We're also, all of you know what we went through for the last couple of years with the C word, and we have been full. We have been at times at 200 patients, and where we're probably have the capability to put patients in a bed of around 130 or so. At times our ICU is double capacity. So we need to add beds. So we're in the process right now of evicting everybody off of our 6th floor, which has been our kind of a support floor where administrative services and HR and all those things are at, and relocating those people to well, actually most of them to an off-site location over at Jay Ransom's old building, the Omnisys building. So we'll have our central business office over there for the foreseeable future, and we're beginning to process soon, probably this fall, to gut that 6th floor and add beds there. That will help us to not be holding so many patients in the ERs and the ORs. And, you know, we're kind of at that point now, even without surge of COVID surges that we've been dealing with. We're always holding patients in the ER waiting for beds nearly every morning. We are full. We have grown with what's going on in the community, and the COVID kind of hit it from us a little bit, so we were a little behind the 8 ball making these changes. A lot is going on at a lot. We've recently promoted Travis Potter, who is sitting over here. He is our new VP of Business Development and Marketing, and his biggest wish, day one, was to rearrange his budget and bring valet parking to our front door, free valet parking. So we're working on that right now. By the way, Travis was the recipient of my encouraging text message this morning. He's on his way to Disney World. I told him the happiest place at Disney World was the bus parking lot drop off and pick up. Right? Really didn't appreciate that, but he actually wants to spend the time with kids in there. Okay, whatever. Recently, also, we have continued to grow through our medical partners, and we have recently added to our medical partners physician group, Dr. Liao, who is with us and going to speak for a few minutes in just a minute. He's no stranger to Hunt County and Greenville, has served us for 20 plus years, but he has practiced in some other locations, and as we have grown, he's recognized it's time for him to consolidate and focus on this market, and has moved into our medical office building. And that's very exciting times. Him and all his crew have transitioned over to the hospital and bringing all his business and keeping all his business in the fold here. So that is a great thing. And he's also helped me a lot in making sure we have 24/7 orthopedic call coverage in our emergency room. We have struggled with that for years and years, but he's kind of helped us resolve that matter. One of our big things that we're working on is becoming a certified stroke center. Dr. Jalil is our second neurologist to come on board, along with Dr. Zanji, and he's kind of leading that charge, along, I guess, with Kristen from a quality perspective and a nursing perspective on being the project manager for us to become a certified stroke center. And they'll talk about that a little bit more here in a second. Dr. Bell was supposed to be here to talk about cardiology. See, yeah, okay. I'll give him a pass. He was waiting for a place to sit. Thank you, Dr. Bell. So our cardiology continues to grow, and Dr. Bell and Dr. Hassan are a big piece of that service line, providing the intensivist services, and we'll let him have some time. And Dr. Shahira is also here from our cancer center, and she'll talk about services. Shahara, yes, I said it wrong. I'm so sorry. She'll be here to talk a few minutes toward the end of our presentations today. And I really failed to invite one of the persons that I really wanted to bring to y'all today, and I caught her last night and apologized. And that's Dr. Cassidy Durand, who is a vascular surgeon. Toward the end of last year, toward the fall, she applied for privileges and started taking call in our ER. And her group, Lamb Vascular, you probably see them advertised in the paper all the time, has rented space in the Ridgecrest building behind the hospital and brought 2 more vascular surgeons. So now we have 24/7 vascular coverage in our ER. And that is a big deal. That's something we've never had before. And they are doing things every day that we haven't done on a regular basis and keep it in our community. And in the future, Rose, don't let me screw up and not bring Dr. Durand to talk to this group, because she
did a wonderful video for us. We can watch that too.
Yeah, her and Dr. Topic have been great for us and great for our medical staff, and have done nothing but help us to continue to grow in that regard. The last clinical thing I really wanted to mention is, as we have grown in all these other things, as we've grown in our cardiology, as we've grown taking care of more of end-stage renal disease patients in the hospital, doing these higher-end surgeries that we used to not do that we're doing now with these providers that have come to the community, we've had to address care in our ICU, and our traditional hospitalists, we had to kind of enhance that service and bring in what is called intensivists to run our ICU. And boy, they have been through it for the last few years with the COVID. And I don't know how we would have made it without them. But we continue to grow and continue to need to have that service enhanced. So our board last month, actually 2 months ago, agreed to work with our hospitalist group toward enhancing that intensivist coverage in our ICU to where we have 24/7 intensivist coverage in our ICU. Now, that don't sound like much to all y'all sitting here, but that is a big deal operationally and clinically for our facility, and a big step. So we're really excited about growing in that regard. And so we're going to have a physician provider in there 24/7, along with our great nurses that are in ICU already. And one of the other things, just a minor thing, I know this is Greenville, but we are getting ready to start construction on an urgent care inside of our facility of the ED in Commerce. So that's a big deal that we're looking forward to having that care alternative there. Instead of walking into the ER, you can elect that urgent care. We had that empty shell space there, and are bringing that to the community. Okay, the last thing I want to bring out, talk about, is we are getting rid of our 25-year-old Meditech electronic health record system. That is a dinosaur. We have worked it well. We've had a lot of people there who knew how to work it. So we're in the process of installing Cerner. Doesn't mean much to all of y'all, but you will have an integrated system in the future that you as a patient can access both your record for both the hospital side and your doctor's side who are on there, and the doctors will have an integrated system to work from, and it will really enhance patient care. All right, back to the phones just for a second, and I'll finish up here. Did anybody get a reply? Is it anything anybody wants to share? You don't have to, but it's just interesting. Anyway, my wife would say, you're doing that stupid encouragement thing again, aren't you? So I didn't send it to her today. My message is really just to surround yourself with the right people and encourage them often, and just watch what the results are that you get. And that's kind of how I lead at the hospital. And we just have a culture of a great place, and we are in a great community. And we're not perfect, and there's work to improve, but at the end of the day, all we really want to do is be the provider that you place your trust in. And we thank you for your time. And Shelly, how are we going to do this? I forget who's coming next. Dr. Top. Okay, we'll let Dr. Top come up, and I guess Colleen's going to help them out and talk about our NICU program. Thank you for your time.
Hello, everybody. It's not scripted, so we have to figure it out. But we know we have 5 minutes. So we're the baby providers. We take care of babies in the NICU. I think most of you probably don't realize that 15 to 20% of all the newborns, so if you have 100 babies born, 15 to 20% would need ICU. Okay? Any guesses what percent needed ICU when we had COVID pandemic? You can go.
10%. 10%.
A little lower.
2%.
5%.
I believe it.
So here we're talking about 15 to 20% needing ICU. So it's very important to have these services in an area. The problem is that when you don't, you have limited time where you could do certain things. And as you know, a healthy baby will make a healthy society, right? And you have limited time. And any guesses how much time you have? And if the damage happens, it's permanent.
First 24 hours.
You got 15 minutes.
15 minutes.
15 minutes. So I was at Baylor for 10 years, and I got calls from this region, and I was the transport director too. So I was the one who was managing this transport team, bringing babies from the surrounding areas. And the calls would come, but it was too late. You go and pick up the baby, but the damage has happened. And it's lifelong, unfortunately. Brain is the only organ where if the damage happens, you don't recover from it. Okay, the rest of the body, liver, I can take out half of your liver, take out the whole lung, one kidney, you will live. You'll be fine. But if you have a small area in your brain that is damaged, it's going to last forever. And we have a neurologist here who can tell us more about that. So healthy baby makes healthy society. And 10 years ago, I walked in. Colleen was there as a nurse in the normal nursery. And their manager introduced me. And I was just visiting a friend who was an internist. I was still working at Baylor in Dallas. And we met. And then what happened?
I thought he was crazy. But he created a level 3 NICU where we really didn't know if we could support that in this area. And since 2013, we've admitted and treated over 2,000 babies. And as a NICU grandmother, I appreciate not having to drive very far to see my twins, my granddaughters, who are in Fort Worth, every day. So I know that that's really important for our community to be able to provide services here. So when parents have to go home and leave their babies in our trust, that they don't have to drive an hour or 2 hours in the city to come see their babies. So.
Thank you. We got last minute. Yes, so now we take care of babies that are delivered and Hunt region. So not just that, but also we're going to be able to bring babies from the surrounding areas too that are really close to us. So inter-hospital distance for transport also determines how the babies are going to do in the future. So if you have a baby born, let's say at Sulphur Spring, and they call Baylor, and it takes them 2 hours to get there, those 2 hours are also critical. Okay, so, instead of 2 hours, if you could treat a baby within 30 to 60 minutes, that would also make a difference. Okay, so the 15 minutes rule would apply if you're depressed. All right, so if you're depressed and you don't resuscitate the baby, you only have 15 minutes for that. But even, when they resuscitate the baby and then they have to transfer out, that transfer time also affects how the baby is going to do in the future. And just the mere fact that having a family right there, most of our families are just within minutes, so they can visit all the time. And one of the big thing is breast milk, use of breast milk in units, especially if they're sick. So, if the baby's admitted at Baylor or Medical City, it's really hard for that mom to take breast milk. So we have actually in our NICU, we have 100% breast milk use, and that's why our babies do so well. So happy to report that our outcomes here are probably on the top in the whole Metroplex. It's good to be here. Thank you very much.
And you may know our expansion. We're actually doubling the size of maternity in our NICU. So we're very excited about that. And that'll be very well needed. Last month, we delivered over 130 babies. And originally, our space was made for a delivery of 80. And you remember the bond in 2019? That's where this is coming to fruition. So we're very excited for that to open very soon.
So I'm Dr. Jalil from neurology. I'm just looking at the Francis where I'll get the okay. So she will be the one keeping an eye on it. So Dr. Jalil, I'm the second neurologist here at Hunt Regional. I'm part of the Hunt Regional Medical Group, medical partner, and I joined the Hunt Regional back in July, August of last year. So still less than a year. So the reason I started the whole program, just to give you guys a background, was primarily to help in the outpatient side, which is where we do the nerve conduction test. People would come in with neuropathy, nerve damage. We did not have any provider who was doing the nerve conduction studies in our Hunt hospital for our Hunt County patients. So that's how I started, and I have a background in the nerve conduction and EMG part. But as I was working over here, what I felt with my experience, I have worked in Chicago Metroplex in Evanston area, close to Northwestern Hospital over there for 8-9 years. And I was leading the stroke program over there. What I felt was that majority of the patients, your family, friends, relatives, they would come in with stroke-like symptoms, right? And what are stroke-like symptoms? Numbness in arm, tingling, slurring of speech, dysarthria. And the next thing, majority, and when I say majority, I'm talking about more than 70-80% of these patients were shipped out to the Dallas area, which I just wanted to figure out what was the piece that was missing, right? As far as do we have to absolutely do it? And I have done almost the stroke director back in my own hospital over there for 8-9 years before I moved over here. And I talked with, it was Mr. Carter, Rich Carter back then. And I did not see anything which was missing that we cannot do at Hunt, And when I presented this as a proposal to Rich, the thing that really surprised me in working in different health hospitals was how receptive he was. And of course, with Lee taking over, he continued with it. And just to speak, like within 3-4 months of me bringing that up, I already had Kristen as my stroke coordinator, right? They already started working on the nursing education, they started working on the ER education, and I still believe it's a very small time, but we have already started accepting, and based on the last 2-3 months, we're keeping more than 80% of the stroke patients locally. So we have almost reversed within the small 8 to 9 month period, right? And I think that's a big credit to the administration more than anything else, because you need to take to have a will to do it. So now, what is my responsibility and what is the help that I've been requesting from Kristen is to keep not only the stroke patient, but also have the community, all of you guys, the trust that what we are doing is equal, if not superior, to what the care that you will be getting at the downtown location, right? And I can tell you that we are, but we need some kind of a pat on our back, right? And the JCO, the Joint Commission, is one of the entity, which is a nationwide entity that provides the stroke certification to the hospitals all over the country. They come in, they assess us, and they check every single mark as far as if we're doing it or not, and then they give us yes you are or no you're not, right? So we are volunteering ourselves, and Lee and everybody has been on board. We are volunteering ourselves in front of the JCO, which will come and make our assessment. And it's a long process. It takes close to 1 to 2 years for the whole thing to. But what I'm very hopeful, and I have done it in the past as well with my other program, is that with the amount of investment that the hospital is putting in, we will be JCO certified. I'm pretty sure. And we will be JCO certified for primary stroke prevention. And once we do it, I'm pretty sure everybody in the community would know it. I mean, do we need it absolutely to do it? I would say no, But I think this will be an added bonus for you as a community leaders, right? To tell your family, friends, relatives that the service that we're getting over here is equal, if not superior. And I think the last thing that I would like to add, what I have been noticing, one more thing that I would like to add, because you are the community leaders, right, is and Kristen can agree with me, is the amount of time that the people wait. And again, I'm just using this as an opportunity to educate all of us as well. The amount of time that we wait. In the Chicago market area where I was practicing, I would have a majority of the people coming in within a couple of hours of the stroke. Over here, it's not surprised that people are waiting several days before they come in with the stroke. And with us, we are time limited as far as we're not as, so the brain is not a muscle like a heart where we can wait 12 hours. We have 3-4 hours. So if you can take one point from this whole meeting, tell your family friend the stroke warning signs, which is acting fast, any facial droop, any arm weakness, all right, any speech disturbance, all right, and the last T is the time. You have to act, all right. So if you can educate, I'm pretty sure, like based on the stroke demographics, there will be some of our friend or relative who might be affected, and just this education will help them a great deal. All right? And I'll be here to answer your questions.
And while Dr. Bellbell's coming up to the stage, I'll just let you know, we have some great flyers at this front table here that talk about those stroke symptoms. So if you want to take one of those back to your business or your home and hang that up, we're really trying to educate people that you need to get that help quickly. So please do so.
Can everybody hear me? First of all, it's great to see everyone without masks. I can see everyone's faces and happy. Thank you for inviting us. I'm sure a lot of you have heard about our program, the cardiology program. Some people out here look familiar to me. I think I've worked on a few of you at like 2 or 3 in the morning. Anyway, I think what we do is pretty well known. We take care of hearts in the worst of times, unfortunately, which is the critical time when you're having a massive heart attack or you're in shock, and So for the last 5 years, we've been taking care of patients in those critical situations in the cath lab. And I've seen some amazing developments and growth in the quality of care in the hospital that has pushed other parts of the hospital to have to deal with, when you're taking care of sick hearts, people having heart attacks, you're going to have to be able to take care of their vascular system and their brains and all the things that happen when these things happen. So I've seen an incredible amount of growth in the skills of the staff and the nurses, and I'm very excited and thrilled to see that happen. So as you know, when people have a heart attack, it's a critical time. It's a very dangerous time. We lose about 1 million people still every year to heart attacks. It got a little bit worse with COVID because people were afraid to come in, as I'm sure you know. And now we're seeing some of the effects of COVID after this, which is delayed heart attacks and inflammation of the heart. We're starting to see a lot more inflammation. I'm sure some of you have heard about this in the media, and have heard of friends who've had inflammation. So we're seeing, we've actually had a patient who had a heart transplant because of inflammation after COVID. We work very well with 2 big transplant centers, Medical City Heart in Dallas and Baylor Heart in Dallas. They're some of the more premier heart transplant programs in the world, in fact. So we're very lucky that we have access to that, and we work with them all the time. One of the things I wanted to talk briefly about that I see a lot here, and I'm glad I'm getting the opportunity to talk to you about all this, is we do see a lot of issues with despair in this community, and that translates into alcoholism and drug abuse. So it's not infrequent that we see a lot of patients come in with damaged hearts because of that. Methamphetamine, cocaine, alcohol severely damages the heart. And so that's not much I can do about preventing that, except education. But when we deal with these patients, it's heartbreaking for all of us. These are patients that usually don't have health insurance. They're usually fairly young. They've lost a lot of hope. They're in despair. And I want you all to remember a little bit of what's going on in the community. It's just sad. We have a lot of despair, sad people that turn to these things. And unfortunately, when they damage their heart, it's irreversible often, very often. And so, you have a 30-year-old or an 18-year-old who needs a heart transplant, doesn't have health insurance, and it becomes tragic, messy, and very, very hard to deal with. I'm glad I'm getting a chance to talk about that a little bit in this community. I don't know what the answers are, other than help to find ways to help with that despair in this community. I know it's hard to hear all that, but it is something we see it practically every 2-3 days. So, but on a good note, statistically speaking, we take care of about 60 to 70 heart attacks a year. We put in about 50 pacemakers, which are basically being put in because you're about to die without a pacemaker. So, as a matter of fact, in about 20 minutes, I'm going back to put a pacemaker in. We're very happy that Vascular Surgery is here to help us. They're awesome people. He was right about that, the CEO. Excellent people to work with. And it all ties together. And we're excited about the stroke program because, again, it all ties together. So with that, I'll stop, and thank you so much for inviting me.
Well, good afternoon, everybody. And first of all, it's such an honor to be speaking in front of a room of very accomplished and diverse leaders in this community. We are so thankful to be a part of this community and to be able to serve this wonderful community. My name is Meera Sridhara. I am one of the medical oncologists here at Hunt Regional Medical Center. I know you've heard a lot about sick babies and heart attacks and strokes, but I will tell you one thing. No matter what the diagnosis is, most people are able to say, well, we'll try to figure it out and we'll try to fix it, but there's always one thing that evokes a lot of fear and a lot of anxiety, and that is the word cancer. So what we see a lot is as soon as somebody is diagnosed with the big C word, which we always used to think was the cancer, but over the last 2 years, COVID has replaced as the big C word. But it evokes a lot of fear, it evokes a lot of anxiety, there's a lot of questions. So it comes with a huge baggage of emotional distress as well as the actual diagnosis. So we are here at Texas Oncology, who has been able to partner wonderfully with Hunt Regional Medical Center to have an amazing cancer center that the primary goal for us is to be able to deliver these complex state-of-the-art treatments to our communities closer to home. And I will try to explain a little bit about what I mean by that. When I first came out here to Greenville, I trained at Baylor in Dallas, and I used to come out here as a fellow. At that point, we did not have a full-fledged cancer center. We had a little hallway between the ER and the OR, which we had about 3 rooms where we used as our exam rooms and had a few chairs set out there to do our chemotherapy infusion. That is what we started with. We're fortunate that we've been able to partner with Hunt Regional Medical Center and have a full-fledged cancer center in our community. We are able to do chemotherapy treatments, we are able to do immunotherapy treatments, and we have a full-fledged radiation oncology center as well, where we're able to offer state-of-the-art radiation treatments to our patients that are going through a cancer diagnosis. And it is so important to have that in our community, because I don't know how many of you are aware. I do see some of my patients here in this audience too, and I'm always so happy to see that. But some of these treatments, like radiation treatments, are daily treatments. So they can be a daily treatment for up to 6 weeks for certain types of cancers. So you can imagine that if somebody had to drive to Dallas or for whatever reason another city, it is talking about 1.5 hours of driving each way back and forth for up to 6 weeks for a condition that already is quite distressful. So having the ability to treat those patients here is not only great for the patient but also for their families, and it just makes it all so much easier. Like every other specialty, we have had COVID impact us in a huge way. We have seen that over the last year or two. A lot of people who would have usually done a lot of their screening, like getting their routine mammograms or getting their routine colonoscopies, were somewhat hesitant to do that during the screening during COVID. And as a result, we're seeing a lot more cancers that are coming to us at a later stage. So I again want to take this platform as an advocate for early detection and try to encourage each and every one of you to talk to your all's doctors to make sure you get the screening you need for your particular age, so that we are able to detect cancers at an early stage. Early stage cancers, regardless of what it is, we're usually able to treat it with very minimal toxicity with all of the technology we have. So I again want to, 2 things I always say at every meeting. One is early detection, and the second thing, like a little bit of what Dr. Bell alluded to, we do have a lot of smoking population in our community. That is one of the top reasons why somebody ends up in our cancer center. So I always take an opportunity to make sure I say the word stop smoking. So if you do that, I hope you never have to show up in our center, but we will be happy to take care of you if you do. So thank you for this opportunity.
Everybody. My name is David Liao. I'm an orthopedic surgeon over here in Greenville. Our host told me try to keep the speech short as possible. Try to tell in this meeting is about what's new and improved in knee replacement surgery. In this country, this year alone, we're going to see probably 1.2, 1.5 knee or hip replacement alone, just this year alone. So knee and hip replacement surgery is become a very common procedure that we do as orthopedic surgeon. So what's new and improved? Last 3 years, we have seen more and more people knocking on our doors saying, do you do robotic surgery? Yes, here in Greenville, finally we can say, yes, we do. A new and improved of the robotic surgery does make a great bit of difference in our clinical outcome and patient satisfaction. I remember when I first came to the States in the 80s. I was college students and I was shadowing some orthopedic surgeon in California. And that's the time I seen a lot of papers, a lot of research about how can we perfect in the instrumentation of replacement surgery. And throughout the 30-some years of the career in orthopedics, we've seen the involvement in surgical, not only instrumentation, but also the implant. And nowadays, we see in the robotic surgery combined with AI, which is making a quantum leap in the knee replacement surgery. So what's the difference about conventional knee replacement and robotic surgery? What can we make a knee like so, a beat up knee, and try to do a good job to obtain an artificial knee like so that is well balanced? Well, a lot of efforts, a lot of research, a lot of actually failure that we have learned that finally come to the stage of knee robotic surgery. I use the analogy like car mechanic when we first try to balance a wheel or tires, how to balance it. In the old days, we take some masters to accumulate years of experience to see the alignment is done correctly. And nowadays, everything is computerized, no brainer. So knee replacement surgery, I see the same thing too. With robotic surgery, that really is a game changer. It's disrupting the old way that we perform surgery. So robotic surgery is done as such. Before surgery of the knee, we do CAT scan on the hip, knee, and ankle. That way we know the entirety of the alignment of the lower extremity. And during the surgery, we put in the little device that we can check out the ligament strengths, and also we can try to balance soft tissues. That is very important actually to get a very well balanced and functional knee. So with robotic surgery, that before surgery from point A to point B, before we cut to the end product, matter of fact, we already know this knee gonna be well balanced. It's gonna be well articulated. It will not gonna be malalignment. It will not be a problematic knee. So this is almost like a GPS of a vehicle that we drive. that we know before we go from here to Gainesville, we already know our destination. So the robotic instrumentation sure does make a difference on my practice. I'm so happy to tell you, nowadays we do probably 400 to 500 knee and hip replacement in Hunt Regional Hospital. And everybody, orthopedic surgeon over here has been trained to do orthopedic robotic surgery. Matter of fact, we have some people from Chicago, from Colorado, the patient I have, they come over here just to have robotic surgery done. Is that amazing? So today I would have to tell you, I have to commend our administration that they are willing to put in $1 million of this machine, and that has been so promising in our patient satisfaction and serving our communities so well. So this time I have to tell you, our pasture is much greener in Greenville this time. People don't have to go out.
They're going to spend the last few minutes asking, getting questions from the audience. Does anybody have a question they would like to ask one of the doctors or Lee?
I don't have a question. I just want to compliment Hunt Regional Medical Center. If you know me, you know I'm one of their biggest advocates. We use them personally. My grandson's been in the NICU. Amazing. Family members have used Dr. Liao for things. We've used the new, my daughter has seen Dr. Sriharda. They're amazing. If you are not taking care of yourself in our community, you need to, because there are some amazing professionals at Hunt Regional, and I can't say enough good things about Hunt Regional and the organization. So thank you all for giving back to our community and making things local for us to use.
Anybody else? Yes, well, I'm very grateful that you were here today. Thank you. Thank you for being an integral part of our community. We appreciate all that you do. At this time, we are going to do some door prizes. So if you've not put your business card in the container, if you'll raise it up and Renee will come by and get it. And then while she's doing that, I do want to introduce two more people. Alyssa Davis, will you stand? For some reason, she's an ambassador for the chamber, and I always forget her. I don't know why. I'm going to say sometimes it's my fault because the business doesn't put the names down on the list. And then I want to introduce another GYP, Greenville Young Professional, John Thomas, because Alliance Bank, Regaling and Insurance did not put your name down either. While we're waiting, I do want to remind you that we have business before hours this Tuesday from 7:30 to 9 at GEUS, and GEUS is wanting you to come by before you go to work and get some breakfast and do some networking. So anytime between 7:30 and 9, you can come for 10 minutes or you can come for the whole time. It's come and go.
2810 Wesley.
And then I'm about to draw, and before you leave, don't forget to stop by the vendors of the Hunt Regional and our sponsors. All right, ready?
Who do we trust around here?
Who wants it?
We have a gift from Hunt Regional.
Who wants it?
Shelly, one of them's a name right, so you might want to.
Okay. So Kristen. Washington. Yes, got the mammogram. And this one is?
Cardiac CT, calcium score, the CT scan screening. Should we give it back to her?
I forget the shoes.
No, they're not eligible to run. Sorry. Taylor Clark.
Taylor Clark. We have a gift from Family First Home Health. Roslyn. And then we have one last gift. This is from the Greenville Chamber. It's an enhancement for your business directory. Leanne Bledsoe, and I think she left, so we'll get that to her. All right, I want to thank you again for coming. And I want you to have an amazing rest of the day.
This video has been brought to you by GEUS 34. GEUS is your community-owned provider for electric, internet, cable TV, and true local programming.